Welcome to Part 2 of Prostate Biopsy, Side Effects and Risks, where we will continue to look at the risks and side effects of undergoing a biopsy. With that said, here we go.
3. Infection. A further risk of having a prostate biopsy is infection. Surgeons will usually prescribe strong antibiotics to reduce the risk of infection. However, despite this, an infection can still occur. Occasionally, these infections can turn into life-threatening sepsis. This is as needles to detect cancer are passed through the rectum. As a result, if the needles transport bacteria from the bowel into the prostate, bladder, and bloodstream, an infection can occur. A study by Johns Hopkins researchers was published in the Journal of Urology. It found that men hospitalized due to a biopsy-related infection had a 12-fold higher chance of dying than those who did not undergo a biopsy. 4. Acute urine retention. A biopsy procedure can cause injury to the prostate gland, causing it to swell. This makes it harder for you to pass urine. If the prostate is particularly enlarged or the man has pre-existing risk factors, then the risks of biopsy-induced urinary retention are significant. Acute urine retention is a medical emergency, and you need to seek help at once. 5. Sexual problems. Several studies have found that men develop erectile dysfunction after having a prostate biopsy. In 2015, BJUI International published a study involving 220 men who underwent transrectal prostate biopsy. Overall, the researchers reported an increased risk of temporary ED after biopsy of approximately 5%. While this happens rarely and should improve over time, the study shows that the effects of TRUS-guided prostate biopsy on ED are most likely underestimated. It is vital to be aware of these prostate biopsy side effects so patients can be appropriately counseled. If sexual problems persist, you should consult your doctor. 2 alternative screening options are an MRI and the PCA3 test. A multi-parametric MRI ultrasound has a 95 to 98% chance of determining the location and grade of prostate cancer cells. According to the Diagnostic Center for Disease, an MRI scan predicts and confirms the presence of prostate cancer more frequently than a biopsy. The PCA3 test is another alternative. PCA3 stands for prostate cancer gene 3, a protein that prostate cancer cells produce at much higher levels. PCA3 leaks into the urine when the prostate gland is stimulated. Unlike the PSA test, a high PCA3 test can only result from cancer, not from an enlarged prostate, inflamed prostate, or other non-cancerous prostate problems. Before undergoing a prostate biopsy, it is important to do your research. The side effects of a prostate biopsy can be a serious concern. However, we have looked at some of the alternative options available to men, from PSA screening to imaging tests. Now it's your turn. Have you had a prostate biopsy or experienced any of the side effects mentioned in this video? Thanks for watching. If you've learned something new from today's video, make sure to subscribe to Ben's Natural Health YouTube channel right now. Just click on the subscribe button below this video.